Welcome to the Royal Aberdeen Children's Hospital. Where every year...
Option number one is chop it off.
more than 20,000 boys and girls from across the north of Scotland receive life-changing treatment.
Can you hear Mummy's voice, Clara? Oh, wow!
From a dedicated medical team.
It's different from Hobie and Casualty and what you actually see in the soaps.
Coming up, Abby struggles with her fear of the dentist.
It's normal to feel scared, okay?
Come on.
I need 5 minutes.
Magnus shows off his muscles.
So then my blood can get pumping.
And anaesthetist Kay prepares Lexi for major surgery.
Do you want to give her a quick kiss, Mum? That's her asleep now.
This is the Children's Hospital. Children and their families travel from across the north of Scotland, including the Highlands and Islands, to receive specialist treatment at the hospital.
Hello! Come in. How are you?
Fine.
You've grown since I last saw you.
Yeah.
This last 6 weeks. Jeez.
Lynn manages the 19-room Archie Foundation Family Centre. This much-needed accommodation is located right within the hospital itself.
If you've got a really sick child, your stress levels are way up anyway. Having this place just takes a little bit of that stress away from them. They know they can come here, they can relax here a little bit, they can make a meal and just chill out a bit. It's home away from home. It's like a mini hotel. They keep telling me that. It's great. We'll have this place.
9-year-old Magnus and Mum Dawn are regular visitors from Orkney.
You said you heard me snoring, didn't you? You just feeling a bit poorly today, or what?
Yeah.
Yeah. You have some breakfast, see if it helps.
Magnus has Crohn's disease, a chronic inflammatory condition which affects the lining of his gut. He needs intravenous drug treatment every 6 weeks to dampen the inflammation and help him digest food properly. To make the procedure go smoothly, Dawn has prepared her son's arms.
We'll put on the 4 bits of magic cream, because sometimes it can take a few times to get the cannulation to happen successfully. We put the deadening cream on a few bits. Always great manners being filmed.
It will take around 3 hours for his treatment, and if it finishes on time, Magnus and Dawn can fly home later in the day.
Did you have your big breakfast? No? You're quite quiet today. You got a sore neck?
Very.
Very sore neck?
Yeah.
Go check your temperature, Magnus.
But his neck has been complaining about.
You are holding it funny. Left side?
Yeah, I can hardly look up.
I'll look up.
Nurse Louise is concerned that Magnus's sore neck might be due to an infection and calls in Dr. Amada.
So can we have a chat about it first of all? Is that okay? So tell me, which part is sore?
Just behind.
Just behind. Is it sore there at all?
No.
If Magnus does have an infection, the team can't risk giving him his drug infusion.
And no rash as well, right?
They just want to double check, because of the way that the medication works, that it reduces his immune system to be able to fight anything off. That they want to make sure that he's in top health before they start putting that in.
So the doctor wants to get blood tests done, put them down as urgent, and then we'll see what they say for the going ahead with the infusion.
I'm just gonna do some press.
Press up.
Magnus has an ingenious way of helping the nurses find a vein.
My blood can get pumping.
There we go. Sometimes the veins hide because he's in for such a regular infusion. His veins are overused.
There you go.
My fingers crossed. We'll get in first time. Yeah? You got your toes crossed as well and your fingers crossed for me.
Muscles. Oh, they're getting bigger, Magnus.
Squeeze. Going for some ghost frogs, I think, this time.
Jesus.
You feeling that?
I'm chuffed. Yeah, it's not often you get it first time.
Oh, I was in a row. I was in a row. So we'll get these bloods away.
The cannula may be in first time, but until he gets his blood tests back, Magnus and Dawn face a frustrating wait.
Magnus has travelled a long way and then not to get it done and then to go back and come back another day. So hopefully, fingers crossed, we'll go ahead today.
Should we go and see your patients?
Consultant paediatric anaesthetist Kay has one of the busiest and most versatile jobs in the Children's Hospital.
So this is the dead case unit. We'll just come up in here. There we are. Hello. Hi there. Are you Lexi? Is that your name? Hi, I'm Dr. Davies, one of the anaesthetists. So I understand that Lexi is going to get a reimplantation of her ureter today. Yes.
5-year-old Lexi is having surgery to fix the tube that connects her bladder to her kidneys.
Is she a wee bit anxious?
Yeah. I think she will be again.
Okay.
Kay doesn't just put patients to sleep for surgery. An important part of her job is to prepare children for their operations.
Because you've been here before and I think you're a little bit anxious, so we'll give you some special medicine to make you a bit more relaxed before you go to theatre. And then what we'll do, we'll get you to sleep breathing some special sleepy wind through a little clear plastic mask just near your face. So Mum will be with you. That sound all right? Who's winning at Snakes and Ladders?
Who's winning? Always Lexi.
It's really important to see the patients before the anaesthetic so that they know what to expect. They want to know how they're going to go off to sleep. They want to know that they're going to be asleep. And they want to know how they're going to wake up and that they'll be nice and comfortable as well.
Anaesthesia means loss of sensation, and without it, most modern operations wouldn't be possible.
How are you feeling, Lexi? Feeling a bit better? Good. I don't get nervous before anaesthetics. The children do, and the parents always are. Some of them hide it really well, so our job is trying to reassure the parents and the children before they come to theatre and just give them a pleasant experience, because they may need to come again, and some of our children come again and again. We just take this nice and gently, Mum, so she's doing really well. I saw what the anaesthetists were doing in theatre and they were always busy. They were always busy doing things, very practical things, and I like doing things all the time, being quite practical, and that drew me to doing anaesthetics. She's just about to close her eyes. Do you want to give her a quick kiss, Mum? That's her asleep now.
But Kay's job isn't finished yet.
Because it's a longer operation, the longer the anaesthetic, the increased risk of post-operative nausea and vomiting. We're using an intravenous anaesthetic for her, so hopefully she'll be less sick afterwards. We'll try and avoid her lovely painting on her arm though. So what we're going to do here is called a TAP block. So it stands for transverse abdominal pain block, and we're putting some local anaesthetic between a couple of the muscles in the abdominal wall, and that will give good pain relief afterwards. It's busy, isn't it? There's more to anaesthetics than people think.
With all pain relief administered, Lexi goes to theatre, where Kay must now keep her stable during the operation with paediatric surgeon Mr. Driver.
As a surgeon, my job is to be there and available when the patient's asleep. But the anaesthetist is there right from the start, so they see the patients on the ward beforehand like we all do. That's the ureter. They're monitoring the patient all the way through the operation. They make sure they're safe, they make sure they've got good pain relief, They make sure that all those things are sorted. So you need a certain sort of person who can do paediatric anaesthesia, and it's not easy to find them.
What we're going to do now is just make sure we've got all our post-operative pain relief sorted, so hopefully she'll wake up well.
After 3.5 hours in theatre, Kay hands over Lexi to the recovery team.
There we are. Good. This is Lexi, and she's got a morphine PCA and a wound catheter connected. We haven't started the PCA yet.
Okay. You want to start that just now, Kate? Or?
Yeah, do you want to do that?
Yeah. Lexi, is it Mum or Dad who's with you today? Mum, would you like to see her? Yeah, should we buzz Mum, I think?
It's just been a normal day, actually. It's been quite busy. We have a patient here this afternoon that's really comfortable, so for me, that's been a really positive thing, and that's probably why I do the job. See you. Bye.
9-year-old Lacey and her mum Claire have travelled from Fraserburgh for a special appointment.
That was before her hair fell out. Lacey started becoming ill when she was 4 weeks old. So eventually she was diagnosed at 7 months with AML, acute myeloid leukemia.
This blood cancer is the second most common leukemia in children.
Lacey was actually so sick she was on life support. And the doctor was honest with me. She's like, well, at night she'll either pull through or she'll die. She says it's like she's that ill that it's a 50-50 chance. If we can't get the cancer cell count down and get her lungs functioning, then she will die at night.
Hello, Lacey.
8 years on, Lacey is cancer-free after intensive chemotherapy treatment.
So it was 23rd of October last year that we saw you the last time.
Yes.
2 days before my birthday.
What we're looking out for is any long-term health effects from the treatment that we had to give to cure the leukemia that was there 8 years ago.
Paediatric oncologist Dr. Bishop treated Lacey when she was a baby. Today, he's doing her annual checkup.
What have you got in your suitcase?
Photos.
Photos?
Yeah.
Okay. Photos of who? Is that from when you were little? You just remember from the photos? I remember that wee face. You spend a long time looking after a patient and their family, so the opportunity to develop a relationship with the people that you're caring for over a period of time. So you were very poorly when you were little, but look at you now. We'll give you a quick wee check over while you're here as well. Fine. Now, do you know where your oxters are? Fantastic. We need to have a wee feel of your oxters as well.
It took me a long time to get over the fear with Lacey. Like every time she had a call, every time there was like a rash or she picked up chickenpox even, I would panic thinking, is it back, is it back?
So you're looking fantastic, as we said, so everything's grand examining you, nothing to worry about, okay? We'll see you in a year again to make sure you're still looking fantastic.
The doctor doesn't want to see me till next year. It makes me feel happy because I don't have to be sick.
She'd passed her 5 years of remission. She's classed as cured, so we can start enjoying life. So that's what we did. This time last year, just exactly this time last year, Imogen started getting really sick.
Imogen is Lacey's younger sister.
I had gotten Imogen up that morning. I had went to get her dressed. And her legs was clotted in bruises, like maybe 20 to 30 bruises. And automatically I started to panic because Lacey got bruises on her legs. In my mind, I think it was happening again, but in my heart, I thought, there's no way like I can get a second child with cancer. There's just no way that can happen.
The chances are 1 in 1.4 million.
So what's on the Santa list, Imogen?
More elves.
More elves! Goodness me!
We know the vast majority of childhood cancer just comes out of the blue and doesn't run in families. But we do know that there's a slightly increased risk of siblings having cancer. Imogen has acute lymphoblastic leukemia, which is the commonest type of cancer in children.
I'm doing a gingerbread man. Imogen, can you let Louise have a wee peek at your line again before I start you and Christine? Little peeky.
They came through, they took the bloods, and they moved us to like a separate room by ourselves. Imogen was lying sleeping. I just put my head in the pillow and I was just going to want to go to sleep when the sliding door opened.
I was quite nervous, I was thinking, I'm not going to be able to do this in the way that I would normally do it. I'm going to walk into the room and they're immediately going to know what's wrong with Imogen.
And the sparkles for you.
When he came in,
Lift it for you. I'll lift it for you. Okay.
like somebody putting a dagger in your heart and pulling it down, that's what it felt like. It was horrific.
That's it. And put some socks on the gingerbread man.
Imogen will have chemotherapy once a month for the next 18 months.
Sometimes I think I really got to be blessed that both of our children come through cancer. And I think that scares me more than... Because it's not lucky for both your children to have cancer, but it's extremely lucky if both of them come through it. New chemo, I think Christine is there.
That's brilliant. The Rainbow Trails Child's Journey in beads. Everybody's is different. Do you know, Lacey, what your ones are? What you get the red ball for is if, when you get blood tests and things like that. So obviously at the start, when you started your treatment, you had your anchor, then your name, and you got bloods, and then you got lots of bloods done.
More than 80% of all children with cancer are successfully cured. The most difficult thing is the small percentage of children that we're not able to successfully cure. And probably one of the hardest things is telling families and telling children who understand what it means that they can't be cured. So taking away hope from somebody that they're going to survive and that they're going to grow up and live their adult life, that's really hard.
Imogen doesn't have the flower.
No, because you know why Imogen hasn't got the flower yet? Because she's not at end of treatment. You get the flower when all your treatment's finished.
I tell myself there's people worse off than me. I think that's what scares me more. I ken people having both the diseases that both my kids have got, and unfortunately none of them are here. So for me, I'm lucky.
Bye-bye, guys.
Oh, we're going to here. Have a good Christmas, Imogen.
At the Aberdeen Children's Hospital, more than 3,500 children have teeth extracted at the dental unit each year. Up to 20 teeth can be taken from a child's mouth in one sitting, but the average number of teeth extracted is 8. Dentist Lauren and nurse Sarah always spend time with their patients before surgery.
So it's Abigail there, it's Abigail the next one.
Unfortunately, 10-year-old Abby is terrified of dentists.
So if you pop your chin up, let me have a look. If you open nice and wide.
She's getting 4 of her molars taken out.
That's fine, so just a bit of a waiting game just now. We just want to check that they know the number of teeth that are coming out. When they put a face to the dentist, if you like, it just helps them, because it's not the nicest sort of process to go through this, but it's a necessary evil.
Abby has hypomineralisation, a condition that stops the enamel forming properly, so her teeth decay very easily.
Do you have any questions? You're right. Okay.
It seems to be a case of the less you know, the better for Abby.
You want to come through with me and we can do the checks? And then we'll bring her through.
Craig is an operating department practitioner, and he's used to situations like this.
Have you ever sucked on an ice lolly for too long and your mouth's gone a bit cold and a bit funny? There's a lot of children that do come in with anxiety and a bit of stress. They know a little, but they don't know everything. What we're going to do is going to take you through next door. You can sit on the bed, your mum's going to sit next to you, and you're just going to relax, okay? If you're uncomfortable or if you need anything, you tell us, okay? That's what we're here for. We're here to look after you.
Okay.
Okay? Are you going to come with us? Oh yeah, Mum's not going to leave you.
Taking out Abby's teeth should be a fairly routine procedure.
Well, what we could do, Abby, is I can give you some laughing gas if you want. And then Craig can tell you his best jokes, which are, I mean, they're pretty bad. They're pretty bad.
Abby needs more than jokes to get her through the procedure. Anaesthetist Sarah has to prepare her for a general anaesthetic.
If it makes you feel any better, I know exactly what I'm doing. And I know exactly what's going on.
Okay.
You'll probably be snoring, and then you'll wake up and you'll be drooling.
Mm-hmm.
It's really glamorous, all this.
It's normal to feel scared, okay?
I need 5 minutes.
Abby's nerves have really kicked in, and she's stalling for time.
5 minutes piece sometimes makes you go in your head a bit more, makes you think and worry a bit more.
I just don't want it to feel sore afterwards.
Like I told you, it'll feel numb, cold. You may feel like you've got a bit of chubby cheeks. Well, that's fine. You're just trying to convey, like, we're here for you. You're going to be safe. You're going to be fine. But it's difficult. It's difficult. So can we try one stage at a time? Okay. Can we have a look at your hand? Okay.
Just to look at
and that's it.
I'll be here. Okay.
Mm-hmm. Okay.
I'm really scared. I can tell you're scared because your hands are freezing cold.
Freezing.
Because I just don't want to be sore.
You're not going to be sore, okay?
With a little patience and a lot of soothing words, the team finally get Abby relaxed enough to insert the cannula to give her the anaesthetic.
That's it. All sorted.
You'll say, Mum, why was I running so much?
What are they?
Yeah.
Yeah.
Look at me. I'm not going to lie. Okay?
Well done.
Hypomineralisation can cause teeth to be quite sensitive. And then if you add decay on top of that, that can make them very sensitive. So the prognosis for them isn't great, so best get them out and then she can have a pain-free mouth.
With Abby safe, comfortable and asleep, dentist Lauren can get on with her part of the procedure.
Upper first, please. I just need the light moved.
It takes Lauren around 5 minutes to extract the 4 affected molars.
Last tooth. Thank you.
Okay. Told you you'd be okay, did I?
Just feels a wee bit strange there, okay? That's completely normal. Well, you've been super brave, haven't you? Well, that's the worst bit gone now, okay?
You'll be okay.
Okay. You okay?
She wasn't nearly as painful as she thought she was going to be, and which makes our job better, that we've done the right thing. She was happy, I think. Is she eating ice cream on the ward, hopefully?
It's sore, but it's not as like bad as I thought it would be. I thought I'd like gonna die. I honestly did.
She did good, yeah. It's just this little blip in the theatre, but you were very brave.
I just didn't know what it would feel like, what would happen. But say I was to do it again, I'd be a lot less like scared because I know what will happen after.
Well, lads, hopefully we'll get home soon.
Got it.
Magnus and his mum Dawn are anxious for his Crohn's disease treatment to begin.
We've never had it not happen, and he has been poorly ill.
They're waiting for the results of a blood test to come back.
It's just with this sore neck that they've got. I'm quite sure it is just muscular like they're thinking,
But if he has an infection, they can't risk treatment, and Magnus will have to return home to Orkney.
It has been a long wait today. It really has. Yeah, it's getting late now. We'll be pushing it to even get the last flight home. We have to be ready to get on the bus to get us out there for 4:30. And it's now 12:30.
Do you want to try talking over?
So the infusion takes about 3 hours, so just about bang on time. Hopefully.
normally straightforward. Normally there's no issues. But it's best to get them checked over and get them examined to make sure the doctor's happy for the infusion to go ahead. So.
Just in the nick of time.
So the doctor's just signed the form to say she's happy.
The blood test is clear and the team can prepare the infusion.
Yeah, it takes a bit of time, this, is it? Very even flight as well.
Obviously, don't want to get home.
We'll get him plugged in and get him started.
In Crohn's patients, the immune system attacks the body and causes severe inflammation. Magnus's infusion aims to reduce that.
You're going to stay holding it, are you? Yeah? That feel okay?
Yeah, it feels cold.
Feels cold. You taste anything?
No.
No. There we go.
I mean, I can feel it.
You can feel it. So he stays on that for an hour and we'll do his blood pressure and temperature. And then you'll stay for an hour on the ward.
Keep it off.
Okay. There we go. Okay. And then you'll get to go home.
There isn't yet a cure for Crohn's disease, so Magnus must continue to travel for his infusion.
How many days do you get off school when you come in to us?
2.
2. That's good, didn't it?
At least there's an upside.
There we go. Sit. We're all good, aren't we?
Yeah.
We're all a good bunch, aren't we?
They're all my favourite.
We're all our favourite.
Before Magnus returns to Orkney, there's a special treat.
Next week, it's his birthday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Magnus. Happy birthday to you. Happy birthday. That's for next week. We'll see you next week for your birthday. Thank you very much, everybody. Bye. See you.